I am Oana Nechita and I'm a second-year food engineering student at the University of Suceava. The topic of my presentation is the role of dietitian in food service management. In Romania, the law of the organization and practicing the profession of dietitian was promulgated on 5th November 2015. According to this law, the dietitian provides healthcare activities of nutrition and/or dietetics issues in assessing the nutritional status of the individual, preparing diets and menus in both the health status and the nutritional therapy care for various conditions as a therapeutic tool in general schemes of medical treatment, food service management and supervision of the food chain in the healthcare unit, and counseling patients and the community on nutrition and dietetics issues in general. The dietitian contributes to defining, evaluating and controlling the quality of products and food diets served in human communities, taking into account the national principles and objectives of the prevention and public health relevant in the field of nutrition and catering. The main areas of practice where the dietitian works are clinical dietitian working in medical institutions, community dietitian working in public health system, academic dietitian evolving in academic field, and administrative dietitian working in dietetics as manager of food units, systems, and services. Their areas of competence are food service management with responsibility to provide quality food and adequate nutritional for individuals and groups both in health and in disease state, public institutions, and other community environments. Dietitians will be employed in hospitals, canteens, restaurants, and companies that produce or sell food. Food and food service are prominent in the history of the profession of dietetics. In USA, food service in hospital was the primary focus of the first dietitians. During the 1890s, food service in hospitals was managed by the chef, the housekeeper, or the nursing department. In the early 1900s, however, many dietitians were in charge of dietary departments and had the responsibility for all food service, plus teaching nurses and providing diet therapy for patients with metabolic diseases. Hospital dietitians dealt with budgets, department organization, personnel management, and quality food service. Nutrition was recognized as an aspect of medicine, and food prescriptions were handled as apothecary compounds, thus creating a demand for special diet kitchens. The hospital dietitian had the same status as the superintendent of nurses and was recognized as the nutrition expert. Dietitians with food service management responsibility become members of the Food Administration, a section in the American Dietetic Association, and their practice was referred to as administrative dietetics. The terminology now used is food service systems management or management in food and nutrition systems. Competencies for practicing administrative dietetics are manage development and or modification of recipes and formulas, manage menu development for target populations, manage production of food that meets nutrition guidelines, cost parameters, and consumer acceptance, manage procurement, distribution, and service within delivery systems, manage the integration of financial, human, physical, and material resources, manage safety and sanitation issues related to food and nutrition, supervise customer satisfaction systems for dietetic services and or practice, supervise marketing functions, supervise human resource functions, and perform operations analysis. And here are some characteristics of successful food and nutrition managers. Dietitians in food and nutrition management need to exhibit leadership qualities similar to those in all areas of business, healthcare institutions, schools, and so forth. They must manage personnel and financial resources, produce quality products and services, and communicate effectively within the organization and to the larger community. But first we are waiting for establishment of the Dietitians College, which will have the authority to issue the authorization of free practice for each dietitian. Thank you.